The agenda is approval of the agenda. The chair will entertain a motion.
So moved. Support.
Thank you. We have motion support. Any questions with respect to the agenda? All those in favor will please say aye. Aye. Any opposed? Thank you. Public comment is now open. Is there public comment? Last call for public comment. Public comment is now closed. Now move to committee items. First is the minutes from last month's meeting. Chair will entertain a motion.
So moved. Support.
Thank you. Motion support. Any questions with respect to the minutes from last meeting? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. And now appointments. We have 3 openings on the Department on Aging Advisory Council. We do have an applicant this month, Robert Dangler. Chair will entertain nominations, especially as to Mr. Dangler.
So
Thank you. There's a nomination for Mr. Dangler. Any other nominations from the floor? Hearing none, all those in favor of appointing Robert Dangler to the Department on Aging Advisory Council will please say aye. Aye. Any opposed? Thank you. Are there any other nominations from the floor with respect to the 2 remaining openings? Hearing none, we'll continue to advertise those. Now the next item is the medical care facility, monthly report and financials. Madam Director is here. Good to see you, Destiny.
Good to see you as well. Please bear with my out of breathness.
Oh my.
I got all the way up here without my report.
Oh
So,
my.
quick sprint to the finish line here. Okay, so for this afternoon, if you could go ahead and go to the next slide and the next one. We're just going to touch on a few quality things. Okay, so for this quarter, we continue to be a 5-star facility. You can see the rankings of the facilities in our market area listed here. On the next slide, we continue to be 5 stars overall, 4 stars in survey, and then this quarter we moved from 4 to 5 stars in quality and remain 5 stars in staffing. We are one of 2 homes in our market area that's 5 stars overall, and one of 2 homes in our market area that are 5 stars in staffing. And we have the lowest nursing turnover rate in our market area at 19.7%, and the 5th lowest in the state, which I thought was a pretty exciting metric to be able to share. We also have the lowest RN turnover rate in our market area of 2.7%, which is the 8th lowest in the state. I would like to note that the 7 above us all have a turnover rate of 0, which does make me question a little data validity or potentially how many RNs they have. So we're pretty close to the top on that. Any questions on quality before I continue on to finance? Okay. So the finance reports that I have is finishing out 2025. So for November's financials, revenue was $283,181 better than budget. However, expenses were $369,498 less than budget, giving us a negative net position of $86,317. We did have 41 admissions and 43 discharges in the month of November, and our census was slightly below our budgeted census with 178 versus 183. Now you'll notice that revenue still wasn't an issue in this month. So thank you for pointing that out, Commissioner Bear. Those numbers that are listed on this slide are, it appears to be an error, a copy and paste error from the actual financial statement. So the financial packet that you received, this is just meant to be a summary of that. Those are the actual numbers. So the variances are correct, but the budgeted numbers shown on this slide are incorrect. Okay. Yes. Moving on to December's financials. Revenue was better than budget by $215,000, $215,476. However, expenses were over budget by $606,813, giving us a negative net position of negative $391,337. Now, I'd like to note on both November and December, the budgeted census was higher than what we achieved both months, but you'll notice the revenue was also higher than what the budget was for those months. And that has to do with the increased Medicaid rate that we received in October, that we did not build into our 2025 budget because we weren't sure exactly what that rate increase would look like. So we did see increased revenue than what we had anticipated, which is great. However, unfortunately, our expenses were also increased. And I'm going to talk about that a little bit more here in a moment. Overall, for the month of December, our census was 181.45 with a budgeted census of 183, so we were behind budget there. We did have 53 admissions and 57 discharges in the month of December. So all in all, year to date for 2025, we did have $384,456 in revenue, better than budget. However, our expenses were 1.9 million, almost 2 million over budget. That overall gives us a change in net position from operations of negative $1,613,238. Census for the year averaged 181.8, where our budgeted census was 183.37, so we were slightly below on that. This year, we did decrease the budgeted census to 183 flat for the whole year. We had 541 admissions in the month or in the year of 2025 and 536 discharges. So if you move to the next slide, I did do a year in review. Census has been a primary component of things we've discussed in this meeting. And I do want to note that although the number in census has fluctuated a lot during 2025, the census itself and the amount of people we served throughout this year was much greater than in previous years. So we had 88 more admissions than our prior year, 87 more discharges than our prior year, which means we provided care for about 3 months of additional residents than what we had normally been able to provide in 2024. I do think that that's a very helpful number to note, because sometimes there's this concern that maybe there's not a need for long-term care services, or maybe the need has decreased in our area. But based on these numbers, we're actually seeing an increase in the number of people that we're serving. We're just serving them for a shorter period of time. On the expense side, of the $1,997,693 in expenses that we were over budget for 2025, $1,274,885 of those dollars were additional health insurance costs beyond what we had budgeted. So excluding health insurance, the remaining expense variance would only be $722,808. If we look at that with our change in net position and the additional revenue that we had, our change in net position would have been negative $338,352, which would have actually made us $33,119 better than budget. So I really wanted to lay out what was the primary driver of overages in 2025. And that really comes down to health insurance costs. And it really was the sole factor in what would have been a budget beating operational year. So I think that that's important for everyone to understand. We did look at our health insurance costs going into 2026. We did bid out that process. I think I've shared in previous meetings that we are self-insured for our health insurance. We did look at going to a fully funded insurance plan. Unfortunately, because of the rate of claims that we have, we were only able to get one insurer to actually provide us with a quote. And that insurer's quote was 85% of an increase compared to the 21% increase that we would see with staying self-funded. So we did remain with the self-funded option. We did add some additional safeguards in place, such as offering a foundation plan for some of our higher claimants to try and help bring the cost of the plan itself down. So for those of you that might not know, health insurance is all based on the cost of the claims that you incur throughout the year. So if we can find coverage for our care partners that doesn't involve the actual plan, it helps strengthen the plan, make it healthier, and bring down healthcare costs for everyone, including the facility. So that's one of the measures that we put in place. Moving on to the next slide, I just wanted to show you the census trend line through 2025. And the following slide is where we are census to date here in 2026. A few additional things. AR days out, our accounts receivable days out, continues to be below our goal at 53 days. Our goal is 54 days. We currently estimate 31 days cash on hand. We do still have that Medicaid repayment that we do have to make. We're estimating around September of this year for the final 1.17 million for the cost reporting error that I've shared with you. And then we do have anticipated right now about $57,000 that we'll be requesting from MOE throughout the year of 2026. And then finally, on this last couple slides here, I just wanted to share a couple pictures of the things that we've done this year and the people that we've served this year. We have a lot of folks that have come through JCMCF for therapy, and they graduate, they get a certificate, and we get to share their story online if they are agreeable to that. But I also want to highlight this picture in the middle here. This is our maintenance director taking one of our residents for a ride in his convertible because he has always wanted to ride in a convertible. So it took, I think, about 5 staff members to help get him into that vehicle with all of the different equipment that was needed. But he had a wonderful time. And these are just a few of the stories that we get to be a part of. And because you guys support the medical care facilities, you are also a part of. And I thought that that was important to share, especially when there's so much concern around the fiscal side of the facility. I think it's important for us to hear where all of that money goes and how it impacts the lives of our community. And then on our final slide here, I just wanted to share with you, this is all of our care partners that achieved perfect attendance for 2025. And that's not easy to do, so I thought it was worth sharing with you. That is my report. Do you have any questions for me?
Questions for the medical care facility? Commissioner Williams, please.
Thank you, Mr. Chair. Good afternoon, and thank you for the sprint. You didn't have to do that, but thank you. The only thing I wanted just to mention is that I just appreciated the additional information in your presentation and in regarding the review of the year. That helped to add some context for me. And then always, it's just good to see pictures as well to put a face to some of the work that you do. So just thank you.
Oh, thank you.
Nothing further, Mr. Chair.
Other questions? Okay. And Destiny, thanks for the report. I do note, I did mention at the earlier meeting, the DHHS meeting, that to please keep us informed as it appears you may have need of MOE funds in addition to what you're suggesting for the coming year. I see it's 57,000. I think that's probably just normally like an interest charge or something like that
Yes.
on the bonds, and which is not unusual, and so that's fine. But as your situation evolves, if you start to run short of cash, you'll please let us know as soon as you can, or as soon as you have an idea of any needs you may have beyond that. So I know you're focused on it, so thank you
Yes.
for keeping us informed.
Yes, and just to kind of give you a little timeline on that, we have not yet received our audit request. So the timing of that audit request for the next Medicaid cost report will be the timing in which we should receive the invoice for the additional 1.17 million. So depending on how that falls throughout the year, if it follows what we anticipate with September, it's going to be tight, but as long as there is nothing unexpected, we should be in okay shape. However, the other piece that we'll be telling is when our bond payment is due in May. So between those two dates, I should be able to give you a little bit better idea of whether it looks like we may need to request some review of the MOE monies.
So let me make sure I understand. You've got cash on hand currently
Yes,
at 31 days, but that includes the money that you're going to have to spend at some point when you have to settle up on the Medicaid audit.
yes,
So once that occurs, that's going to take a big dip in the amount of cash you have available. Am I correct in
That-
saying it that way?
that is correct. Yep.
Okay, so that's when the cash crunch is going to
Yeah.
potentially occur.
Potentially, yes.
Yeah.
Yeah.
Okay. All right. So just to make sure members are aware of that. Okay.
Okay.
All right.
Thank you so
Any
much.
further questions for the director? And the chair will entertain a motion to receive the reports. Thank you. Thank you. We have motion support. Any further questions? All those in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Thank you. And now the Department on Aging. Good to see
Good
you,
af-
Danielle.
Yeah, good afternoon, everybody. For my February report, I just kind of wanted to do a reflection back to the first quarter of our grant year. So you'll see some numbers on my report reflecting October of 2025 through December of 2025. And you can see that the number of people that received the grant home delivered meals, we had 726 homebound older adults, and we served around 71,000 meals during that time. If I reflected back to that same period in 2024, that number was slightly higher on the number of people. We were at like 713, but the number of meals was a decrease. We served about 74,000, and some of that can be related to the inclement weather that we've had. So when there's a snow day, we're not producing those meals that are going out. And so that would be a fluctuation there. Also, I think the thing with the Meals on Wheels is that each plan is specialized to the person. So somebody might get 14 meals per week, somebody else might get 5 meals per week. And I really feel that people look at their care plans, and if they see like they're not eating a full meal plan, they ask to decrease it. It's also something we discuss at meal reviews, so that we try to look and prevent waste within the service. So I think that helps to encompass why you might see a little bit of variance in that number. But it's always something that we keep track of and wanted to share. With the number of people that have visited the Crouch Center in our first quarter of our grant year, we had 880 people. It's a little bit higher than the number in 2024, which was 866, so pretty much right on track. So not a huge jump or decrease. With the number of clients getting home services, you can see for 2025, we had 244 people. During that same quarter in 2024, we had 229 individuals. And the number of congregate clients, we saw a decrease there. It was 428 in 2025, but in 2024 it was 434. Not a huge decrease, just a little bit there. The number of meals was about 500 difference, like $5.50 to be exact. And part of that is one of our nutrition sites at this time is having some difficulty serving meals. Their community center is closed, so we're serving them more as like a grab and go. And because it's a grab and go type of program, we cannot count that because they're not actually congregating. So we're still trying to meet the needs of the people in the complex as they are working through their issues until that community room is back open. So I think that also plays into the decrease in that number. A little bit of highlight on our community support that we receive. Eaton, we recently reached out to their employee group, and they've done different things for us in the past. They've have painted bowls for our Soups On program. They have packed emergency meals, and due to the number of inclement weather days, we reached out to them in January, and they came in and they packed emergency meals for us, and they were ready to go the next day. So they packed a lot of meals. So we love the support from our community partners that will kind of jump in and support the services that we provide. To highlight with the nutrition program, the theme for 2026 is Serving Up Solutions. And part of that, you think about the meals that are provided at the congregate sites, and you think about all the activities, and we're trying to engage with the older adults. So we'll be highlighting all the different things that we do in March and adding in some different programming. With Senior Project Fresh, just to highlight, we will be the lead agency for Jackson County again this year. Part of that, some of the benefits that will happen is that we will be able to see how many coupon books are left or how many packages are available for people. It's something we did not see last year. When the state switched to more of a what do you want to say, like an app application where people didn't have to apply on paper, it was more electronic. There was some decreases in the state redemption rate. So the state redemption rate was like down to 66% in 2025. And for Jackson County, it was 65.8%. So the electronic version, when it kind of rolled out, there were some different delays that happened, which impacted the redemption rate, and people were a little bit confused about how the system worked. So this year, what we're thinking is that being that lead agency, we'll be able to help the older adults see if they have money left on their card, and also can see how much money is available within the Jackson County area, so we can continue to help promote the program. Those are things that were not available to us last year. We could not see those numbers. From what the state's showing us this year, we'll have more access to that information, so that'll be a benefit. Just to give you some information about in 2024, when we actually had like paper coupons, our redemption rate was 87%. So dropping down to like 66% was a huge difference. So again, we're hoping for some improvements so that we can help make sure older adults are taking that benefit and getting fresh fruits and vegetables. And I think it'll work well with the things that Grow Jackson is trying to do. So hopefully some of their individuals will be part of the Project Fresh as well. And I just wanted to highlight, it's very small on your report, but a client comment when you think about the people that receive our services, and again, always putting that to the forefront of who we serve. This was a note that was recently received in January. The person wrote, "There is no way words could cover it. The blessings all of you have been to the both of us. The meals have saved us. My wife had several surgeries in the last year and a half. She has had heart surgery, she had open heart, 2 back surgeries. She fell and broke her right shoulder. She's just this week had to have a stent put in. I am also dealing with my own issues. So when I say that you and your volunteers saved us, I really mean it. Please tell everyone we love them, and the Lord bless each one of you in 2026. And of course, they noted that their favorite meal was the meatloaf and the Wiley potato with chili. Oh, and the goldfish cookies they really love. So again, the impact that we make for the services, this really is, the client that you're trying to reach and help keep in their homes.
Can you please remind us when the Soups On for Seniors event is, please?
It is March 10th. Currently, sales are picking up. It is a Tuesday. Just should have said that. It's always on a Tuesday. It is March 10th. Ticket sales have been picking up in the last week, so I think we're nearly 100 already of people that have bought tickets, so we're pretty excited about that.
And can we do that online? How do you go about getting tickets?
You can get tickets online if you visit the Friends of Jackson Seniors website.
So Jackson Seniors, okay.
Or people can come to the Department on Aging and purchase tickets in person as well.
March 10th. I'll mention it in my township meetings tonight.
Okay.
Okay.
One question.
Commissioner Willis, please.
Yes, ma'am. You mentioned that one of the community center sites was down. Do you know which site and how long that may be down? Do you know that?
It's a high-rise complex, Park Forest.
Okay.
And they're trying to resolve some of the issues that they're having to get that site open. It's been down for a little bit, so we're just trying to make sure that we can meet the needs of the people that are in the facility.
All right, thank you. And I also just want to say, for many, many years that you guys had a congregate site at King Center, and I know how many senior citizens really depend on those for food, meal, and to be able to socialize some. So really appreciated the work that you all do. So
All right, thank you. Yes, I agree. I think it's more than just the meal. It's the friendships that they bring together so that when they leave there, they have another support.
we still go back and go on a trip every year there, so we enjoy it. So thank you.
Thank you.
Okay, Chair will entertain a motion to receive the report. Thank you. I have a motion to support. All those in favor will please say aye. Aye. Any opposed? Thank you.
Okay, thank you.
Thank you, Danielle. And now I think the Health Department is up next. Good to see you, Matt.
Good afternoon. I'll highlight just a few things in the overview, of course, answer any questions that I can. Matthew Budd, Deputy Health Officer here for Kristen Pluta this afternoon. To highlight some things going on in our community health and education promotion programs, we also received some positive feedback we'd like to share. So we received and highlighted 3 different pieces of feedback that we got from our maternal infant health program. So our program that works with new families, pregnant mothers, infants. They said that we were very responsive to their needs, helped reach milestones that the family thought we helped them achieve sooner than they originally envisioned, and really helped increase resources for families. And that's really the goal of a lot of our home visiting programs for infants, pregnant mothers, is to help them realize what resources are available in the communities and help them reach their needs for their children. So that was good feedback to receive. For our health education programs, there's a couple things to highlight. Our programs are up and running in the schools again this winter semester. I think that they're going well. Notably, we don't have a current teen pregnancy prevention initiative health educator in the role currently, but we're making it work. We're still doing the team meetings and the classroom education, and we are in the hiring process to get a new educator in there during the school year. So our coordinators kind of still making those work. If you don't mind scrolling down a bit for me to opioid response, which will be the top of the next page. Thank you very much. For the opioid response, we've been without a health educator in that program for a few weeks, but we just hired someone new. I think this is maybe their 3rd week with us. We're really excited to get her onboarded and started with the program so that they can start working a bit more with the community. For personal and preventative health services, there's a few things that I'd just like to highlight here. I thought it was probably helpful to talk about the yearly overall counts, that graph. As you can see, we've had a slight decrease, about 100 clients less each year for the last 3 years visiting our clinic. I like to explain that as a partial good for the community. One thing that changed with COVID is a lot more pharmacies have vaccines, a lot more urgent cares are in the community, so people have a lot more options than they really did looking back at 2018, 2019. We're still a resource for those community centers, so we work with all of the vaccine providers in the community with physicians that provide vaccines for children, including monthly meetings for those groups to talk about vaccines and to help address any questions that they may have. And also, we're a resource for sexual health in the community as well. When anyone's diagnosed with an STI, we do follow up, make sure that they receive treatment, make sure that partners were treated as well in circumstances that we can. So we remain busy, even though we have a slight decrease in the number of clients visiting our clinic. We have decreased staffing some in our clinic too with these numbers. If you don't mind scrolling down to the WIC program. One big change that's occurring in the WIC program in March is we're having a food package change. This should make things easier for our families on WIC. WIC has always had different product size requirements, such as they have to buy like 12-ounce packages of certain items. A lot of those requirements are going to be removed or made easier. So now it will be up to 14 ounces of certain products, for example. So if they pick up a 12-ounce container of a product, they're going to be able to purchase it and no longer be rejected by the store. So that should be helpful for a lot of different items. They'll look at ounces for milk, so they'll be able to buy multiple size containers of milk and things like that to really help families grab the options that they want to grab at the store. Like all rollouts, we'll see how it works with the community, but we're trying to prepare our WIC participants now, giving them the new shopping guide, talking over what these requirements are going to look like. I'll also note that I've had multiple dentists in the community reach out to me to ask about juice consumption in our WIC families, because juice is, of course, part of the package that WIC families receive. WIC is now going to start offering additional vegetable and or fruit dollars for participants if they don't want the usual juice credit. So that's kind of a nice thing we're trying to talk many families into too, just because fruits and vegetables are generally very healthy products for our families, and juice is pretty much only sugar. But we'll see how we do with that. That will be in March. If you don't mind scrolling down to the bottom. The Environmental Health Division, in the winter, we slow down slightly, just a lot less construction going on when the soils are frozen, and we have a big burst of restaurant reviews that occurred in March. During this time, we're still working on implementing a new software for our environmental health team, which should help kind of bring us up to 2026 in regards to having good filing systems. We're working on looking at our procedures to make sure that community members receive the services they need when they work with an environmental health team. January was also Radon Awareness Month, so we did a couple PSAs. We worked on putting an advertisement out on Spotify, which we really like to do because we reached about 8,000 people in 2 weeks for a pretty small amount of money. Just to let people know about the dangers in radon, Jackson, of course, is known to be an area where a lot of homes do have high radon. There's ways to mitigate it, test it. We offered free radon test kits at the health department in January, and we passed out 56 radon test kits. This was the first year we really kept track of how many we provided in Radon Month, and that's something we hope to do in the future as well, because I think it's between about 1/3 and 40% of Jackson homes are known to have high radon if they don't have a mitigation system in place. Those are some of the highlights I wanted to bring up today. If there's any questions, I'm happy to see if I can address them.
Commissioner Willis, please.
Thank you, Mr. Chair. Just a question regarding our food truck inspections and plans. How current are we, do you know, and what is the status of that? I know one time we were waiting for, I think, to hire a couple more, or at least one more person for inspections and food inspections, and there were some people waiting for food truck inspections and floor plan reviews.
I can follow up on that. I don't know off the top of my head how far back we might be on our plan reviews and inspections for food trucks, but if you don't mind, I'll get you an email later
I
today.
appreciate it. Thank you, sir. Thank you, Mr. Chair.
Matthew, when you send that out, please copy the entire committee if you would, please.
Will do.
Thank you. I had a question on the naloxone restocking. I see 955 boxes. Is that 1 month's worth of restocking?
I'd like to get back to you on that,
Okay.
just to be sure.
Okay.
I do know that we have several different sites around the community, and we have people going weekly and sometimes more often to replace those stores. So we
okay.
do give out quite a bit.
And how many different sites do we have there?
I know that we're at several different rest stops on the highway system.
Yeah.
I want to say 3 of those. And then I know that we work with harm reduction. Let me get you some more sites too. But I know that the 3 rest stops we have a different rotation going on to make sure that those are all stocked.
Okay. Well,
There is HSB. We do have naloxone outside in a little to-go unit as well.
okay. Thank you. And I will tell members, I had an issue arise out in Hanover that was brought up to me by the village out there, and Matthew was very good to come out and look into the issue, and the village was satisfied that he was thorough and addressed the question that arose. So if things come up where you need involvement of the health department, Matthew and the rest of the staff there have been very responsive, and we appreciate that. Commissioner Willis, please.
Last time, sorry, thank you, Mr. Chair. Do you know if they had filled those positions that they had opening in that department, environmental health? They have.
We have an open director position that we're not currently seeking a candidate for at this time, just as we go through a transition with the new software. So that's the only position I can really think of right now that was vacant, and a vector-borne position. The one that just became vacant is posted. There was one that just became vacant a week ago.
Okay. And that's posted now?
Yes.
Thank you, sir.
Yeah, if you know anybody, please send them our way.
Chair will entertain a motion to receive the report. Thank you, Commissioner Williams and Commissioner Bear. All in favor will please say aye. Aye. Any opposed? Thank you. Thank you, Matthew. Appreciate it very much.
Thank you.
And I think, sorry, I have to get back to the agenda here. Claims are the next item. The claims have moved back and forth. Has everyone seen the claims yet? I think at last I saw was down at Tony's End. Chair will entertain a motion to pay the claims. Thank you. And we have motion and support, and all in favor will please say aye. Aye. Any opposed? Thank you. Other minutes, please take note of the VA meeting minutes and the DHHS board meeting minutes for your information. And now, public comment. Public comment is now open. Last call for public comment. Public comment is now closed. Committee member comments? Committee member comments? Hearing none, we stand adjourned to the call of the chair. Thank you.